Tonight, we're here to provide you with information on COVID-19, identifying the impacted areas, and discuss the rates of spread. After which, we will be providing an update on what we have done to be prepared as a city and what potential impacts and actions may result. To begin the report, I will turn it over to our Assistant Director of Emergency Services, David Harrison.
Good evening, Mayor, Council members. As you know, national health authorities and their counterparts around the world are trying to contain and mitigate the spread of a new novel virus called COVID-19 or coronavirus. Scientists and healthcare professionals are still learning how this virus behaves. We know it's highly infectious, often passed between people who are within 6 feet of each other through the droplets produced when an infected person coughs or sneezes. And over the past few weeks, while the virus's rate of spread in China has slowed, we've seen it increase in other regions. Many of the terms used when describing this outbreak have quite specific definitions. There is one important term that you may have heard in the news recently, and that is community spread. Community spread involves members of the public who have become infected with the virus, and medical authorities do not know or have not yet determined how or where that person became infected. This is a key indicator for public health officials that the virus may be spreading beyond their efforts to contain it. For the City of Carlsbad and other public agencies, it is a potential signal that a more impactful series of mitigation practices may be necessary. This group of practices are often referred to as social distancing strategies, which will be returned to and discussed in more detail toward the end of this presentation. City staff has been closely monitoring the spread of the outbreak, which is shown in this slide. At the same time, staff has been monitoring the preparations and responses made by medical and governmental authorities around the globe, and more intently, in the United States. This slide, prepared by a Johns Hopkins University team and updated daily, shows the global spread of the virus. This map has been used by many in the media. You may have already seen it. There are now over 118,000 cases worldwide, the majority still in mainland China. In the United States, 34 states now have confirmed cases, the greatest impact occurring in Washington state. With respect to California, the Centers for Disease Control and Prevention has reported the occurrence of community spread in Northern California. San Diego County reported its first case of presumptive positive case of COVID-19 yesterday. This case is pending CDC confirmation. It is a travel-related case. It is not a case of community spread. Nevertheless, the county's public health officer has said it is only a matter of time before more infections emerge in San Diego County. This chart provides an overview of COVID-19 cases over time. The orange line on top shows COVID-19 rate of spread in mainland China. It has been leveling off. The yellow line on the bottom, the rate of spread in other countries. It has been increasing. And the green line, the third line, shows total recovery over time. That is also increasing. The city's Emergency Management Administrative Team, or CMAT, following the direction of City Council to be a leader in emergency preparedness, has been preparing hard to prepare for the city's possible responses to this outbreak since just after it was reported. The first action, as just described, has been to keep a close watch on global, national, and local status of the outbreak. While the situations in other locales may not impact Carlsbad, the lessons learned there may be very helpful here. We've been engaged with health agencies and public jurisdictions, other agencies and organizations, regional stakeholders, fire departments in the region and across the state to develop coordinated multi-agency plans and coordinate actions. Carlsbad has encouraged regional coordination on this issue. And third, we have reached out to and or met many of Carlsbad community sectors, Carlsbad Unified School District and schools, Carlsbad Chamber of Commerce and Businesses, residential care facilities for the elderly, service organizations, and others. Again, the purpose of this engagement has been to raise awareness and share sector-specific information and coordinate as appropriate. Many of these contacts were initiated weeks ago. The response from these community sectors has been terrific, and I would like to thank those involved, some of whom may be here with us tonight. Also, staff has been working to make sure the city has an adequate supply of resources. Carlsbad's Communications Department has been actively sharing information with the public and city staff to help mitigate the virus's spread. I'll provide some specific examples in the following slides. And all city departments have been reviewing and updating their segments of the city's Continuity of Operations Plan, including its pandemic section. This slide shows some examples of the communications I have just discussed. Such communication has included regular updates from the city manager, posting proper hand washing instructions. Human Resources is here with us this evening and has prepared instructions for supervisors for employees to share with staff to ensure proper hand washing, respiratory hygiene, and staff cleaning precautions, as well as other actions. Here are examples of public information sharing. They have included links to official sources of public health information, summaries of the city's preparedness planning actions, and other relevant information. These have been shared using all available channels, including the city website, social media, traditional media, and email lists. And it has been shared using flyers and handouts to ensure all segments of our community are informed. What are some of the impacts we might expect? Community spread of COVID-19, when it occurs, could have impacts such as reduced staffing as a result of illness and a reassessment of how and perhaps which city operations and services are provided. It is likely COVID-19 will place additional demands on city fire and police as well as other city departments. In the event county public health officials confirm community spread of coronavirus in our region, city leaders may need to activate the policy group as detailed in the city's emergency operations plan. The policy group evaluates the impact and determines appropriate response actions. For example, those involving social distancing that I mentioned earlier. Social distancing practices could include canceling public activities and events, closing and/or decontamination of impacted city facilities, implementing telecommuting or other technologies, implementing the city's Continuity of Operations Plan, and other steps that might be unique to the outbreak. The city's goal is to protect the health and safety of Carlsbad residents and those who work in or visit our city. We have been proactively planning to ensure that goal is met. There's two last points I'd like to share, and those are that the CDC and other agencies are asking older Americans, 60 and above, to carefully consider their travel plans, whether they're international travel plans and others, and carefully weigh the benefits of that travel versus the potential risks associated with it. And there's also been some suggestions that they consider appropriately adding to their home supplies of normal food and household goods and medicines, so they should be coordinating that with their doctors as appropriate.